Meanwhile, in the national capital, there's been a spike in the COVID cases as well. Delhi has clocked about 1,500 fresh infections in just the last 24 hours, taking the positivity rate of 4.62%. It's now reached 4.62%. So now there is a demand for the third dosage or the booster dosage to come in. For many people, they still don't have access to it because of the gap that has been recommended by the Health Ministry.
Straight away going across to Sharon for a quick update, because Sharon, in the last 1 week, Delhi has been clocking over 1,000 cases almost on a daily basis. The positivity rate is also going up there. We are looking at meetings after meetings that are being conducted exactly when it comes to the precaution dose. Should the gap now be shortened?
Well, that is what the experts have also been debating, that with the cases, the rise in the cases that we are seeing, specifically when we talk about Delhi, because if you see the active cases, overall, around 40 to 50% of the cases overall that is being reported in India is coming solely from the national capital, and that is of course concerning. The positive, the silver lining over here is that the positive rate has not crossed 5%. But with the surge that we're seeing in national capital, in coming days, it could be possible that it can cross the positivity rate at 5%, and that exactly is going to be very concerning. And that is why the experts have been saying that the 9-month gap for the precaution dose is something that needs to be reconsidered, and it should be cut short to about 6 months so that more and more people can get this immunity, can get booster dose, and accordingly the spread of the infection could in fact be contained.
Right. Sharin, as of now, the recommendation that has been made is for 9 months gap between the second dose and the booster dose. But as the demand increases, the demand has been to reduce this gap as well. Initially, there were fears that enough vaccine dosages will not be available. Also, demands coming in for vaccines for children.
There is in fact enough vaccine is what the main two vaccine manufacturers, both Bharat Biotech and Serum Institute, have been saying, that the demand of India as far as the precaution dose are concerned, that is something that they are well equipped with, though Bharat Biotech's plant has been shut for about a month now. But apart from that, they have enough manufacturing as far as the vaccines are concerned. Secondly, there is in fact a news that is coming from the Health Ministry that NTAGI could actually discuss about how the 9-month gap between the second dose and the precaution dose should in fact be shortened, the gap should be about 6 months. But that is of course what our sources have been telling us. We have to wait for an official confirmation from NTAGI. Once NTAGI decides on that, they will pass on their recommendation to the Health Ministry, and hopefully in coming days, as experts have been suggesting, it could be cut down to 9 to 6 months.
All right. For the moment, Sharon, thanks very much for joining in. We are looking at many people also being recovered from COVID-19. Meanwhile, it has still maintained its upward swing with as many as 1,070 patients who have recovered from COVID-19 in the last 24 hours. With that, we head into a short break.